Hi everyone, welcome to Top RN Academy. I'm Anu. I'm here again with another NCLEX topic, epiglottitis, which is a respiratory pediatric condition. Before going to find out what is epiglottitis, let's see what is epiglottis. Maybe you all know epiglottis is a leaf-like cartilage which is present at the back of the tongue. You can see in the picture the white structure there is epiglottis, and let's see what is the function of epiglottis. Epiglottis actually closes when we swallow food, preventing the food from entering into the respiratory tract or into the trachea. But during breathing, the epiglottis opens, allowing air to go into the larynx. So this is the function of epiglottis. So now let's move on and see what is epiglottitis. As the name suggests, epiglottitis is the inflammation of the epiglottis. If you look into the picture there, that's a normal epiglottis, and the one on the right is the inflamed epiglottis. You can see that the normal epiglottis, you can see the opening, but the epiglottis is inflamed, it is edematous, and it is obstructing the airway. So the inflammation of epiglottis which result in upper airway tract obstruction is called epiglottitis. So let's find out what are the causes of epiglottitis in children. It usually affects children. It is spread through droplets, and the causative organism of epiglottitis is Haemophilus influenza type B bacteria is the main cause of epiglottitis. So the children who is not vaccinated with hip vaccine is the one for the prevention of Haemophilus influenza type B bacteria attack. So if the children is not vaccinated during their 2, 4, 6, and then the fourth dose is in the 12 to 15 months, for those children who are not vaccinated are at more risk of getting epiglottitis. So another causative organism is Streptococcus pneumoniae, but the main one and the most commonly one is Haemophilus influenza. So let's see in detail what are the signs and symptoms of epiglottitis. The signs and symptoms are classified under 5 Ds. These all symptoms start with D for your easy understanding. Let's see the first one. The first one is dysphagia. Dysphagia means difficulty in swallowing. It is inflamed, it is obstructing the path, so the child will have difficulty in swallowing. The second one you see is drooling. The child may have difficulty in swallowing the saliva, and this will cause drooling. And the third D is dysphonia. The child have difficulty in talking as well. The voice will be muffled. So very difficulty in talking also. And the next one is dyspnea. Dyspnea is difficulty in breathing. The child have great difficulty in breathing because the airway is obstructed. And the last one is distress. The child will be in great distress because the child have breathing difficulty. Child will be agitated, restless, crying, because the child is not able to explain everything what it feels, isn't it? So the child is in great distress. And the next characteristic symptom or classical symptom of epiglottitis is tripod position. If you see in the picture there, the child is sitting, leaning forward, supporting his arms on where he is sitting. That means the child is having difficulty in breathing. Will be using there will be chest retractions, nasal flaring. These all indicates respiratory distress. So tripod position. And the last one and the main one is stridor. Inspiratory. V is the child. The airway is getting blocked, and when the child is having inspiration, you can hear the wheezing sound. This is a medical emergency. That means the child's airway is getting blocked very quickly. So this classical symptoms of epiglottitis is very very important, and there is lot of questions always coming in NCLEX from epiglottitis. So let's see, as a nurse, what are the nursing intervention, or what a nurse should know if a child come to you with suspected epiglottitis. So a child is there with an inflammation or breathing difficulty, and if you suspect epiglottitis, you should think first. You should never ever insert anything into the child mouth. Even to take the temperature, you shouldn't be inserting the thermometer orally. No throat cultures, no tongue depressors. You shouldn't be opening the mouth even to check. Because why we shouldn't do it? Because this can cause spasm and go to complete airway obstruction. The child is already in distress, and if you suspect epiglottitis, never ever insert anything into the child mouth. This will cause spasm. So as a nurse, you should keep the intubation tube ready, because any time there will be complete airway obstruction though. So the endotracheal intubation tray should be ready for the child. And the next your thing is, you have to keep the child as calm as possible. The child is already in distress. You shouldn't let the child cry more and more, and this will cause more contractions and spasm and cause complete airway obstruction. So you should allow the child to stay with the parents. Whatever thing you can do to keep the child calm, you have to do it. Another nursing interventions are, you have to keep monitoring the child's respiration, heart rate, oxygen rate, the color of the lips, chest retractions, and nasal flarings. These all indicate respiratory distress. These have to be continuously monitored. And what is the treatment? The main treatment, if the child needs intubation, should do intubation, and the child should be kept nil per oral, that is NPO, and it shouldn't be giving anything through the mouth. Then should start the IV fluids, because we are not giving anything through the mouth, so the child will go into dehydration. So it should give the IV fluids, antibiotics for the to treat against the causative organism, then antipyretics. The child will definitely have fever because there is an infection going on. Then corticosteroids. The steroids help in reducing the inflammation and edema, so have to give corticosteroids. So these are the treatment plan. So as a nurse, what you should educate the parents for the prevention of epiglottitis. We know that there is a vaccination available for Haemophilus influenza bacteria. So the hip vaccine should be given to all children in 2 months, 4 months, 6 months, and 12 to 15 months of time. So the parents should be educated about the importance of giving vaccination to the child. So these are all about epiglottitis, and it is a very important condition in NCLEX point of view. And I hope you all understood it very well, and stay tuned for more NCLEX videos. Thank you so much.